How many weeks pregnant are you? Your doctor will start your pregnancy calendar on the first day of your last menstrual period. The average pregnancy is in fact 266 days in length, which is 38 weeks, not 40 weeks as calculated by your doctor. The reason for this discrepancy is that conception actually takes place about 2 weeks after the start of your menstrual period. Although the 2-week period during and after menstruation is counted into your 40-week gestation term, you are not actually pregnant during that time. But your doctor will calculate your due date based on the start date of your last period. Historically, this was the only definite date available. Although some women may know the actual date of conception, the 40-week calendar is still used. If you are uncertain of your last menstrual period, dating can be by ultrasound. Diagnostic ultrasound is an imaging method that uses high-frequency sound waves to form images of structures within your body to produce a sonogram, the picture that the ultrasound generates. Ultrasound is energy in the form of sound waves. During an ultrasound exam, a transducer sends sound waves through your body. The sound waves come into contact with body tissues and the waves then bounce back like echoes. The transducer receives these echoes, which are turned into images. The images can be viewed as pictures on a video screen. This is an example of an ultrasound taken during pregnancy. Most women will have at least one standard ultrasound exam during pregnancy, which usually is performed at 18 to 22 weeks of pregnancy. Hospitals in England offer all pregnant women at least 2 ultrasound scans during their pregnancy, at 8 to 14 weeks and between 18 and 21 weeks. The first scan is sometimes called the dating scan. The sonographer estimates when your baby is due, the estimated date of delivery or EDD, based on the baby's measurements. The dating scan may include a nuchal translucency scan, which is part of the combined screening test for Down syndrome. The second scan offered to all pregnant women usually takes place between 18 and 21 weeks of pregnancy. It is sometimes called the mid-pregnancy scan. This scan checks the fetus's physical development, screens for major congenital anomalies, and estimates gestational age. A standard ultrasound exam also can provide information about the number of fetuses, the fetus's position, movement, breathing and heart rate, an estimate of the fetus's size and weight, the amount of amniotic fluid in the uterus, the location of the placenta, and if the fetus is in good position, it may be possible to tell the sex. In preparation for a pregnancy ultrasound, in the early stages you will be asked to have a full bladder, and this is best to wear a 2-piece outfit so there is access to your abdomen without you removing your clothing. You may eat normally prior to having a fetal ultrasound. During an ultrasound, you lie down on the examination table or bed. An ultrasound technician applies a special gel to your abdomen and pelvic area. The gel is water-based, so it shouldn't leave marks on your clothes or skin. The gel helps the sound waves travel properly. Next, the technician places a transducer onto your abdomen. The transducer is moved about to capture the black and white images onto the ultrasound screen. This is an example of a twin pregnancy ultrasound.